Well, Rossella Miccio is the president of Emergency, a non-governmental organisation dedicated to providing free, high-quality healthcare for all. And she is joining us now from the Port Sudan on Sudan's Red Sea coast. Thank you so much for your time today. I know that your organisation, Emergency, have been on the ground for the entirety of this two-year conflict now as we enter year 3. When the UN say that Sudan is now the world's largest humanitarian crisis and that it is facing catastrophic breaking point, can you just describe what that means in terms of what you're seeing on the ground and the scale of it?
Well, the situation here is really dramatic in the country. It's a huge country where more than 40% of the population is in need of humanitarian aid. 12 million people have been forced to leave their homes, and sometimes even twice or 3 times because the front line was coming closer. There's Khartoum, the capital, has been for the last 4 months completely without electricity, no running water, no access to food, particularly in the last 2 months. Fresh food was not available. So it's really very, very difficult to make a living in this situation. And where in areas like Port Sudan, when there is no active fighting, the cities have been overwhelmed with the IDPs. Population has been tripled with a very poor infrastructure, particularly the health infrastructure in the country was weak before. Now it has collapsed completely. So very, very difficult situation.
The WHO are saying that 26 million people, that's roughly half the population, are now facing acute food shortages. Are you seeing evidence of famine already taking hold in parts of Sudan?
Not in the area where we are. For sure, malnutrition has increased, both for children and adults. We have seen malnutrition in adults, particularly those who have different diseases, and then with no access to food, this is creating an increasing and worrisome level of malnutrition. Famine, we have not really seen famine in Port Sudan or in Khartoum, nor in the city of Niala, where we do have another pediatric center, but definitely an increase in these areas of the level of malnutrition. Food poisoning, because people have started to eat also expired food. So definitely access to proper nutrition and food has been an issue all through these years.
I know that your organisation have a number of paediatric centres or medical centres around Sudan. And we saw, obviously, last month that the Sudanese army retook the capital of Khartoum. What ability did that give you to service those medical facilities and to return there to continue your work?
Well, we have been working in Khartoum continuously since the war started, because we were there since 2007, actually 2005, with the pediatric center and the center for cardiac surgery. Over the past 2 years, it has been a real challenge to make sure that the hospital could receive the necessary medical, technical supplies, the food, but also the medical staff to run the facility. And over the last 3 months, the situation has been particularly dire, because for 2.5 months, Khartoum, particularly the southern part of Khartoum, until the army has retaken it, was completely sealed off. So we had the containers stuck for 2.5 months in Shendi, together with the medical staff needed. And finally, 3 weeks ago, we were able to allow these supplies in, to change the team, the medical staff. I was able also to reach Khartoum for the first time after a year. And it was.
It's good news. It's good news. I just wanted to get your thoughts. Yesterday, we saw European leaders meeting here in London to push once again for a ceasefire. After 2 years of war, beyond simply an end to the war, what is it that you need most from international leaders, and what would your message be to them?
Well, first of all, to match the needs for humanitarian assistance, because last year the needs were covered only up to 50%. So it means that 50% of what was needed was never available for the Sudanese people. And then to push for a broader access for humanitarian assistance to the population in need. It's not easy because also logistically the country is really huge and there are areas that are not safe, but people do need to be supported. It's really urgent. And of course, the end of the conflict would be the best solution for the people of Sudan.
Yes, of course. Rossella, we admire the work that you're doing there and we appreciate your time with us today. Thank you.
Thank you. Thanks for talking about Sudan.